Absence of person-to-person interpreters is important. Blind patients are lacking key operative and creature aware of severe care issues, such as abortion, via a pill machine. The Victoria Derby program has scientific lot of such struck say they wish to be purified as equals by the NHS. While Jeff Parfitt became disappointed for a puncture biopsy endoscope, he requested an translator to explanation which was event. But down there were not any accessible. He panicky, hauling the endoscopy, a pipe in a diminutive chamber on the end, out of his flesh. It was a urgent order, but it had to be deferred. Mr. Parfitt, who was unborn blind, was leftward shocked. The clinic wherever Mr. Parfitt is routinely reception treat for his lymphomas has begun with live video interpreters, on a framework named Mark Dwell. It allows users to choose up a pill, clock a quantity and immediately be associated to a live video translator. Developers say the live video-based BSL services is lifetime changing and can propose insertion, availability and equity to the blind society. But several UK Mark tongue users in severe public health facilities say NHS hospitals are with the facility in inadequate situations, and how they are regularly testing engineering problems, occasionally for severe serving. There has been the instance for Mr. Parfitt in the history, while the framework has unsuccessful medium conversation, manufacturing him rather disappointed and irate. The 49-year-old says how though if the framework was safe, he would quite talk in man. I can see their flesh tongue. I can get how communication more clear, he explains to us via a person-to-person translator. While you include a plain communication on a pill, down there's no feeling down there. Lot Mark tongue users choose to use an translator of their selection for a care assignment, frequently since they are debating susceptible data. The person-to-person translator Mr. Parfitt previous utilized, Rebecca Ost, was the one who said he had carcinoma, and later helping him undergo the news story onto his household. Indifference, one Mark tongue customer, who willing to stay nameless, says she was said she had miscarried via a pill. It was the at first period I'd always had an iPad translator and I didn't very know which was departure at, she says. I was in such a country of scare. Other include contacted us proverb they include never been proposed a person-to-person or live video translator and include to trust on household to talk in doctors, or written things downward on a chunk of document. The UK Blind Associate says the can conduct to care vocabulary and diagnoses creature unjustly reported. The Mercy has as well dealt in cases wherever household members include had to speak their blind favorite ones how they are moribund. Several UK Mark tongue users, yet, are in favor of the live video interpreters in instances wherever susceptible or severe news story is not creature debated. Amanda Holland is blind and plant at Derryford Clinic in Plymouth, wherever Mr. Parfitt is a patient. He's lot facilitating currently. I include an translator down there whenever I requirement a, she explains. I fair get the iPad and clicking on the application. You expect 10 to 15 seconds, and later you are associated in the translator. Amanda shows us how the app plant, but the framework crushed. Our flow talk is diminished to guesswork and brush gestures. We clock up once again, but are taking into account a various translator. And once again. And once again. Before we ultimately get the identical A. After, it intermittent out once again. Mark Dwell, who evolved the plate, say web speeds in NHS hospitals are frequently not powerful quite for live video interpreting services to job correctly, and how care personnel must be aware of their current restriction. Maker Joel Kellhofer, who was unborn blind, says the technique is not designed to substitute person-to-person interpreters, particularly in cases wherever severe data is creature divulged. Charities say the use of live video translator is symptom of the broad issue of an absence of asset for blind human beings to dwell as equals. But Derryford Clinic's Claire Jukes says the use of Mark Dwell is no a cash-saving schema. He's on manufacturing our services as accessible as probable so we can maximize the communicating how we include in blind patients. The NHS has not yet answered to a query for commentary. The Division of Public Health and Public Thoroughness told it was inappropriate if blind patients are not reception the supporting the requirement to accessing NHS thoroughness. It added, "We wait NHS trusts to do institutional arrangement to contain there as necessary, and we modified the law so how public health and thoroughness providers are juridically required to ensure human beings in a invalidity or touch losing in data how they can accessing and know." Charities wish changing to go quick. Blind human beings already include a reduced lifetime expectation, lot high probability of impoverished psychological public health, and are more than potential to include high cholesterol or diagnosed diabetic, says James Watson O'Neill, head execution of the Blind Public Health Mercy Mark Public Health. Still each date, blind human beings are fighting to volume serving and talk in doctors and medical staff since they discover down there is no mark tongue translator. How be reasonable? Mr. Parfit is as well encouraging of changing. He believes if such enforce were blind, changes would quickly be done to the way they are purified. Thou can fair think if the planet switching places and I became listening and everyone else became blind, he says. Human beings wouldn't be lucky.